Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. How do we decrease joint pain? The type of pain where it's chronic shoulder pain, knee pain, elbow pain, right? Without any real trauma. So if you get into an injury, right? You fell, you injured yourself, you damaged the muscle and so forth, those will tend to heal either with physical therapy, muscle work, chiropractic, or sometimes you need orthopedic intervention where you need a surgical intervention. But what about those people who have chronic shoulder pain and then when they have an MRI, there's nothing wrong there, okay? Those are the types of patients we're talking about when we have chronic joint pain. In our office, what we like to do is address the underlying mechanisms of the inflammatory process. So when we have patients who come in and have joint pain, how do we go about it? Well, the first thing is to understand what is going on. So chronic pain has an immune component to it. What that means is that there's an inflammatory immune response within the joint. So why would someone have chronic pain due to an immune component, right? Well, sometimes it's the GI tract, the gut, right? The gut has 60 to 80% of your immune system there, right? So if we have 60 to 80% of your immune system in the GI tract, then maybe the gut has a role in joint pain. So when we look at it in terms of trauma versus metabolic. Like I said, if you had a traumatic injury to a joint, that's very different from someone who's got a metabolic condition and has joint pain, right? The people who have metabolic conditions like IBS, fibromyalgia, small intestinal bacterial overgrowth, those are the metabolic patients, right? So let's give an example. Someone comes in with shoulder pain, didn't have any real trauma, but they have persistent shoulder pain, let's say on the right side. Oftentimes what we find is with those patients is they have an ileocecal valve dysfunction, maybe due to SIBO, or small intestinal bacterial overgrowth, or they have a liver issue, right? Or they need liver support. Sometimes what we could do is do an ileocecal valve massage or release, or we can give them liver support and all of a sudden the shoulder pain will subside. So there's definitely an organic component to a pain syndrome. So SIBO, or small intestinal bacterial overgrowth, 80% of people who have IBS has SIBO, and 90% of people who have fibromyalgia tend to have SIBO, right? So why is this so important? Well, when you have SIBO or you have GI dysfunction, what happens is the absorption rate will change. So things that should not cross into the bloodstream will cross into the bloodstream because of gut dysfunction. So you have an elevation of toxins that can occur. When you have elevation of toxins, then it will start to cause an inflammatory response within the systems. So it can localize to, let's say, an elbow issue or a shoulder issue or a knee issue that's persistent, right? There's no structural damage there, but it can be painful. And some people can have some osteoarthritis, but there are people who have arthritis have very minimal pain, and people who have a little bit of arthritis have quite a bit of pain. The underlying factor can be organic or issues of the GI tract, okay? So how do we go ahead and address patients who have non-traumatic pain, right? They didn't have a particular injury, but they have persistent pain. So when we have joint pain, what we like to do is put patients on an anti-inflammatory diet. What does that mean? It means basically eliminating foods that are known to cause inflammation in our body, right? In general, these are generalizations. Now, everybody will have different food sensitivities. Some people might be just certain types of shellfish. Some people, it could be a whole group like gluten. So when we say anti-inflammatory diet, we're looking at being gluten-free, dairy-free, and maybe lectin-free. And some patients they have issues with nightshades. So what we like to do is do an anti-inflammatory diet And then maybe adding some anti-inflammatory herbs, right? Or nutrients like turmeric. We also want to increase essential fats. Fats are essential components of cellular function, so we want to increase essential fats, particularly EPA and DHA, right, omegas. We also want to do a GI support. Like I said, the GI function has a lot to do with immune response within the joint. So we do GI support, and there's a lot of them, so it has to be more specific or tailored to your individual needs. But things like diglyceride licorice, L-glutamine, aloe vera extract, etc., right? Even berberine. Another thing we like to do is increase short-chain fatty acids. The short-chain fatty acids like butyrate, acetate, propionate will help, one, give fuel to the gut so it can replenish itself, but two, it has a lot of different immune responses and global and anti-inflammatory responses, blood sugar response, etc. So short-chain fatty acids. And then we also want to increase vitamin D, and we want to get it up to 60 to 80 nanograms per milliliter. And the reason we do that is because the vitamin D also helps tight junctions in the gut, right? So it's very important to address issues with the GI tract to minimize joint pain. And what people don't realize is that when you do this type of thing, it's not just about gut function, but it can affect joints and also possibly like skin inflammatory issues, autoimmune issues where there's an immune response to your own tissue. So you have to look at the underlying mechanisms. Now these are all generalizations, right? Because we can give you all the research on different types of nutrients and certain types of potent antioxidants and so forth. But at the end of the day, you have to figure out what a patient needs individually. Because what helps one person may not help another person in terms of resolving underlying mechanisms for joint pain. So it's very important to find the right practitioner, the right doctor, to understand what's going on with you, okay? I'll go ahead and link a couple of keywords so you can go ahead and search these types of nutrients for yourself, and we'll see you guys next week on the healthy side. Have an awesome day.